Does anybody object to that?
No.
All right, so we just began the recording.
God damn it.
So if we could just make sure that our microphones are off while we have the presenters, and if you do have a question, you can put it in the chat, or you can raise your hand, and I'm gonna keep up with the chat as best as possible. You don't have to have your cameras on if you don't wish to have them on. And with that being said, our presenters today are Elise, thank you very much, and then we also have Mary, so the floor is yours. And somebody, we could just hear somebody talking in the background, so if you could just make sure that your microphone's off.
All right. Are you ready for me to start, Missy?
Yes, so sorry about that. Yes, Elise and Mary, the floor is yours. I should have said that. Thank you. Appreciate
That's okay. So I'm Elise Adams. I am the center manager for the Monadnock Service Link team. And I will be presenting today with Mary. Mary, do you want to introduce yourself?
Sure. I am Mary Shonley. I am center manager for Hillsborough County Service Link.
All right, so today we're going to be talking about the data collection form. Let me see. I have several screens open, so I'm gonna stop my video just because I'm not going to be looking at the camera. If I can find my cursor.
And that's no problem. Just remember, others, if you don't want to have your camera on, you don't have to.
Okay, so I keep losing my cursor, so just give me 1 second. Okay, there we go. All right. So today's agenda, we'll review our goals for today. We'll do an introduction to the DCF, which is the data collection form. We'll go over person-centered options counseling, how to know when to use the DCF. There'll be some scenarios and quiz. So basically we'll go over scenario and then you'll let me know whether you should use a DCF or not. And then we'll do like the technical piece of how to complete the DCF. All right, so by the end of today, you should be able to understand the purpose of the DCF. So why are we doing this? Not only will you know why you are doing it, but you should also know when to complete it and how to complete it correctly. Okay. So the DCF was created by UNH to help with a report called the No Wrong Door management tool. The report reflects the work we do for person-centered options counseling. The Administration on Community Living, ACL, is the primary source of our funding for ServiceLink. They take these data points, they collect them every 6 months, and they use it to determine if or how much funding the state will receive. The state can now pull this data by county using the DCF form, and they can tell who is doing DCFs or who is doing person-centered options counseling using the DCF. So if you're not completing the DCF, it looks like you're not doing person-centered options counseling, even though we know that pretty much all of the work we do is considered options counseling or person-centered options counseling. We can also use the DCF to apply for additional funding from other sources. So person-centered options counseling, it's the thinking and practices to empower individuals to make informed choices about their long-term services and supports options consistent with their personal goals and needs, as well as assisting individuals with navigating the various organizations, agencies, and other resources in their community. ACL wants to know how many times we are providing person-centered options counseling. That is where the DCF comes in. We're using the DCF to be able to tell ACL that from March to June, we did X amount of person-centered options counseling interactions. So we can't tell them what we're doing if we don't have the DCF. The Navigate system is just not built to provide that sort of data for us. Okay. So person-centered options counseling, you'll see it as PCOC as an acronym. So when we do person-centered options counseling, we do a DCF form. These are like the 4 triggers to know when to do the DCF. So did you talk to a person about their situation? So if Susie calls, did she tell you her whole story? Then yes, you do a DCF. Did you assist her with making decisions or providing her options to help them or her decide what to do next? So if you provided options or assistance in any way, then yes, you would do a DCF. Did you help her come up with a plan? Did you send her a 800 form, or did you tell her that she should contact legal aid? If you came up with some sort of plan, whether it's verbal or written, then that's a DCF form. And do you have plans to follow up with her? If you do, then that's a DCF form. So it's about, most of our calls are going to require a DCF form. All right. When don't you do a DCF form? So the only times you do not do a DCF is if it's a basic INR call. So by basic INR, I mean the person called and they specifically asked you for the telephone number for someplace, or an address for someplace. It's not you pulling the information out of them, but they're specifically asking for specific information. You do not do a DCF for Medicare only calls. That includes Medicare Savings Program, LIS, and new to Medicare. That means that if they called and you are only helping them with Medicare, there is no other discussion about housing, food stamps, anything else. It is no DCF. And then the last time you would not do a DCF is if they already had one done within the last 6 months. This data is collected every 6 months, so we only need one data source every 6 months.
And it looks like we have a question from Tina. Go ahead.
I'm sorry, Elise. I know I should probably know this answer, but if you did a data collection form related to housing in January, and then a client comes to you and now it's related to caregiving, say in March, would you do a DCF at that point?
So the
Or
DCF
no?
form is, you can add to the existing DCF form.
So you wouldn't do a new one.
You would just add to the existing.
Okay. Sorry. Thank you.
You're welcome. All right. Does anybody else have any questions before we move on? Looks like Joyce does.
I do. Following up to Tina's question, is there ever a time when you would use a new DCF form for a client, for an existing client?
Only if it's been 6 months since the last one was put in.
Perfect. Thank you.
You're welcome. Anybody else have any questions?
Is everybody familiar with how to add to the existing data collection form?
Nope.
No.
We can go over that when we get to where I'm going to walk you through how to even create one. So we can do that when we get there.
Perfect. Thank you.
All right. So we're going to move on to the scenarios. I'm going to, you can either read the scenario or listen to me read it to you. And then you're going to tell me in the chat whether it would be a DCF form or not. If I can find my cursor. There it is. All right, so this is the first scenario. Jane is calling because her husband passed away recently and she needs help. She expresses concern about affording her home, food, and is very worried about affording fuel in the winter. Do you do a DCF?
So far, everyone is saying yes. And then we have one person saying no.
Okay. So yes, you should complete the DCF because you should gather information about her situation. So that's the number one thing. You would have created a plan for her to get her needs met, and you would be following up with her and to make sure that the plan that you guys created together is the best plan for her. Any questions about that? Okay.
I have a question.
Yeah.
I said no because that sounded like information and referral.
So
and
if it was information referral, then Jane would have called and asked you for a specific information. So she would have asked you specifically for the phone number for DHHS or specifically for the fuel assistance program. But you're talking to her,
Okay.
you're pulling this information out of her. So you're talking about her situation. You're talking about her needs, and you're coming up with a plan for her. So it's not just specific information. Go ahead, Mary.
So Betsy, it's not a matter of us not providing them resources, and I think that's where sometimes people get confused. Even with an options counseling call, we're going to be providing them resources. The difference for us is that when we consider options counseling, we're talking to them about options. We're talking to them about all different types of resources. So it's not like we're not going to give them referrals. We are. But it's options counseling in the sense that we're providing them a lot of information about a lot of different potential resources.
We're likely supporting them through those resources.
Correct.
All right,
does that help?
Yep.
Okay.
Okay, So Alan calls and is retiring at the end of the month. He needs to sign up for Medicare. Do we do a DCF? All right. So it looks like everybody is pretty clear that if it's Medicare, we don't do a DCF.
So you guys understand.
You're going to throw a monkey in the wrench?
Yeah, I'm not going to throw a monkey in the wrench. There is on the form, there is a question that says, is this a ship encounter? That has not been, that was put in there for a specific reason. And that had to do with the fact when DCF was first coming out, the state, we were putting so much emphasis on DCF, the state did not want us to forget about the ship form. So they put that question in there. However, that question does not have to be answered on the DCF form at this point of time because it doesn't relate any longer. We're hoping to revise the form enough to take that question out because we used to have to go in to refer to do the STARS form. We no longer do that. So it really was in there just as a reminder to staff that if they were doing an options call and they also included Medicare, not to forget about the STARS form. But that question doesn't have to be answered at all. It doesn't relate to the BCF form at this point in time at all. So you can just ignore that question on the DCF form.
Correct. So anybody that said no, it's correct. You're correct. We don't do DCFs for anything that's Medicare related. It's all reported in stars and CSRS. However, if he were to talk to you about additional concerns not related to Medicare, then yes, you would do a DCF. So if you're talking to him about Medicare and then he starts talking about not being able to afford it and his house being in foreclosure and he needs housing, then yes, you would do a DCF at that point. Any questions about that one?
Okay, so it looks like we have one question. So if you ask question to determine a person is a candidate for Medicaid benefits, not CFI, or long-term care, Medicaid, it's considered options, assistance, and do a DCF form.
So basically, Betsy, if you ask any questions at all, it's a DCF form, whether it's related to Medicaid, housing, anything.
And it looks like we have another question. Would the best practice be to err on the side of caution and complete the DCF form if a staff member is unsure, referring back to information and referral, or should staff be checking with their supervisor to ensure most accurate data reporting?
I would say check back with your supervisor, but that's really not my decision.
I think for the most part, guys, if you think in terms of what we do in terms of our job, if we're asking the person anything about this situation, if we are trying to understand what's going on with them, that really is a DCF form that's really part of options counseling. It doesn't just relate to Medicaid. It relates to any sort of options that we're providing to individuals. So we may not even talk to them about Medicaid, but we might be talking to them about housing. We might be talking to them about applying for food stamps. We might be talking to them about housing and transportation. All of those are considered options that we're working with the client on. For the majority of time, we really would be doing a DCF form because most of the time we are asking, we're in conversation with them. And that's one of the parts that triggers a DCF form is when we start having a conversation with them about their situation. So in most cases, I agree with Elise in terms of, check with your supervisor, but for the most part, you are going to be doing a DCF form on almost every call that we take. Because you're talking in terms of options, not in terms of just Medicaid. So for us, our options counseling encompasses almost anything that we do.
Mm-hmm.
All right, thank you, Mary.
Lost my cursor again. There we go. All right, scenario 3. Kate took a nasty fall last winter and has been having trouble rehabilitating. Her doctors aren't sure if she will be able to return to work and is suggesting she explore in-home supports. Do we do a DCF? Perfect. Looks like most people are saying yes. Haven't seen any no's. So yes, you should complete the DCF. You gather information about her situation and should have explored options and set up a plan. You will have also followed up with her to make sure that that plan is still correct for her needs. Any questions about why that would be a DCF? All right, scenario 4. Tina calls and wants the telephone number for ABC Home Care. Is this a DCF? People are jumping the gun in there. All right, good job, because she's asking for a specific telephone number. It is just basic INR. We're not giving her any other information other than that phone number. All right. Any questions about that? All right. Scenario 5. Tina calls and asks for the number to the home health agency. She doesn't have a specific one in mind, but is looking for any numbers you can give her. Do we do a DCF? All right, so this one has a lot of mixed emotions in there. Okay, so yes, a DCF is needed. Unlike in scenario 5, the caller is looking for information on home health resources. So in order to get her the correct resources, we're going to be asking her questions. We're going to ask her what kind of home health is she looking for? Is she looking for an in-home homemaker? Is she looking for personal care? That sort of thing. We're also going to ask her if she's able to financially afford in-home supports. So we're going to be pulling information out of her, which means yes, we would do a DCF. Does that make sense?
For the individuals who said no, does it make sense as to what the differences are between the two?
Yes.
Okay.
Yes, Betsy.
Okay, you're good.
Yeah, so anytime someone calls us, even if they're saying, I want to know, I'm looking for home health agencies, a lot of times we'll be asking them, what it is that they're, we try to pull from them what exactly is going on that they're talking about home health agencies, that, what are they looking for? Are they looking for private pay? And that the minute you start that type of conversation, you're pulling it into a DCF form. Because the whole point of when we're talking to them, we're trying to understand exactly what they need. And part of it is that conversation we're having with them and eliciting the information from them so that we can get to the point of providing them with the appropriate information. So the minute we start the conversations like that, that's a DCF form.
All right, thank you, Mary.
Oh man, I need a blinker on my cursor so I know where it is. There it is. All right, so this is the final scenario. You were working with Shelly and you see that she already has a DCF in the system from 6 weeks ago. Do you do a DCF? Perfect. So correct, you don't need a new DCF unless it was created after that 6-month mark. So no DCF is needed. You can add to the existing one if it's a new need. Any questions on that final scenario before we start getting into the other pieces? All right. Okay, so a DCF will always be done for caregiver supports, whether they receive a grant or not. Even though we're using T-Care now to collect the specific data for the caregiver program, we still need to capture it as a person-centered options counseling interaction. You will also do a DCF anytime you do any sort of application support, options counseling, long-term care, and hospital transitions. Those are all automatic triggers for a DCF. Any questions about that? Okay.
Hello?
Hello?
I have a question about the hospital transitions.
Mhm.
We get a lot of calls from like social workers and nurses in a hospital situation, and they're not giving a specific client. They're just saying, you know, what are the services available for, for somebody that's getting discharged and lives in Plastow or something like that. Would we fill out that form in that case?
No. So the hospital transitions is like a formal agreement with a hospital where you're receiving referrals directly from the hospital. But you could do a DCF for your interaction with that social worker.
That's what I'm asking. So we would, even though we don't really have the information about the specific patient/client.
Right. So in this case, the client is the social worker because you're assisting her or him.
Okay. Well, I don't know exactly what the form looks like, but I'm wondering if we'll be able to answer the question. But
it's just the
I guess we'll
DCF.
wait till
You would
then.
just do the regular DCF. There would be no sub form.
Oh.
Yeah, she hasn't seen the sub form yet.
Okay.
This is
Okay.
Karen. Nancy's talking.
Yeah. Okay.
Oh,
Thank you.
okay.
Oh, I guess we'll see it when we get there. I'll see it. Thank you.
All right. So now what? Now that you understand when to use the form, now you have to know how to complete the form. So let me get out of here for a second. We're going to go into navigate. I'm going to close this so I don't keep losing my spot. Share. All right. Can everybody see my navigate screen? I can no longer see.
Great.
I can no longer see your heads. So.
Yeah.
Okay. So I just pull up Daffy Duck. That's my go-to person. I'm not sure why, it just is. So in order to see if there's or open a DCF, you have to start a contact. So we're gonna start the contact. So in this case, Daffy has a existing DCF, but it's from June. So we're gonna start a new DCF form. So this is the data collection form. It'll pop up and look like this. Sometimes it takes a minute to pull up. Sometimes it's quick. It's a little finicky sometimes. You can still see the existing one here, but because it's been more than 6 months, we're going to add a new one. You're going to want to make sure before you even get into the DCF form that all of the demographic information is up to date and navigate. Otherwise, it won't pull over to here. You can check off any of these that apply. If none of them apply, you click non-apply. And then here it says identify needs and wants. So this is where you will identify the type of assistance you helped the person with. If it's not there, then you're not going to click on it, or you're going to click the one that's the closest to it. So some examples of access to healthcare would be helping the client overcome barriers to paying for services. So helping them apply for insurance or Medicaid. Locating healthcare providers, including the in-home support services and dental and vision services. Housing, if you're helping them with housing. Access to healthcare and health insurance. Would be checked off if you're applying for Granite Advantage. If you help someone find a food bank or apply for SNAP, then you're going to use food access. I know that a lot of people struggle with this section, so if anybody has any questions before we move on, why don't you raise your hand or put it in the chat.
All right, it looks like we have a question. Betsy, go ahead.
Am I being heard?
Yep.
Okay.
Yes.
I guess, I feel very comfortable being honest and upfront here. So I just need to be clearer about the process of taking a call and gathering the information and noting it and providing the resources and so forth. And when you use this contact form, I think I'm a little lost on that. And sometimes I don't get the contact form. I just want more, if you could just lead us through, I get a phone call and I want to, or I have a voicemail, which I copy and paste into the body of the note section. Do you know what I'm getting at? I'm just not clear.
So you
And
kind of
if-
want like
Okay.
a walkthrough from start to finish.
And not only
Okay.
that, but if Aunt Janet calls about Uncle Billy
Mm-hmm.
and I go and I create, I know this is very basic, a data collection form. I'm putting in, the client is the caller.
No, the client.
The client
The
is
client is the person that's going to receive whatever resource that you're referring. So
all right.
if Billy's calling about Aunt Jackie is the client, Billy is the contact.
So I should be able to put in the person that they're calling about in here. Yeah, so I
Mhm.
would like a step-by-step because I think I'm not,
Okay.
it'll be easy for me once you give a step-by-step.
Okay.
Okay.
So Betsy, the purpose of the DCF form is really to provide, there's an agreement between the state and the federal government to say that if we're doing PCOC interactions, the feds have a data that shows that. So they
Mhm.
developed the DCF form for that. So every time there's a PCOC interaction, there should be a DCF form.
Mhm.
So it should go on the client. So whenever you're putting in navigate, if somebody's calling up regarding services for someone, it's the for someone who's always potentially the client.
Mhm.
So when you do the record and navigate, you would open it up under the client. DCF will pull from the client record.
Mhm.
Okay.
Yeah.
So that's how all that information gets put into the DCF form.
Mhm. Thank you. So, if I get a call or I get, the voicemail, and my first steps are what, and then just lead me through when I would use the data. Well, I know when to use the data collection form, but I guess how to use it in the whole flow of taking a call.
So so let's use Daffy Duck again. So Daffy, let's say Elmer Fudd calls about Daffy. So Daffy's going to be over here in the client section. The contact is going to be Elmer. So we're going to add the data collection form. And when we add the data collection form, it's automatically going to pull Daffy's information, even though we're talking to Elmer. You can put the contact person's name in here if you're not talking directly to the client. Oops. Because that's not going to automatically pull over.
That's helpful. Thank you.
And then you would move through the form as if you're filling it out in the client's perspective. So even though you're talking to Elmer Fudd, you're going to fill it out as Daffy.
Right.
Does that make sense?
Mm-hmm.
Okay, so we're gonna.
Excuse me, I'm sorry. So if we were talking to a social worker, how would we complete this form?
So the social worker would be the client because you don't
Okay.
have the client's actual name. So you're
Yep.
assisting the social worker.
Okay, so just fill it out for the social worker. Okay, thank you.
Yeah.
And it looks like Gary has a question. Go ahead, Gary.
Yes, so I've never ever filled out one of these ever. So, and I do the VDC program. How would this tie into my program?
Doesn't.
So I believe that we decided that VDC would not be counted on the DCF forms.
Okay,
Is that correct, Mary?
Yeah, it used to be because we had a subform in DCF that related to the veterans program. The problem is that you couldn't do a subform without automatically opening up the DCF form. So you always created one to do you always had to have one open to do the subform. They're no longer requiring the subform to be done for the program, as far as I know. So you wouldn't be doing a DCF form.
okay.
Yeah, I think they collect it through a different
Yep.
avenue, so it's not even needed.
Okay, thank you.
You're welcome.
We are getting some background noise. If we can just make sure our microphones are off if we're not asking questions.
Kind of sounded like somebody was doing some Buddha stuff.
Or driving.
It
I don't know.
was like a meditation hum. Okay, so back here. So check all that apply. So individual with a disability, veteran, caregiver, or none apply. Sorry, there was a emergency with my daughter, so I was trying to see what was going on. Identify needs and wants. Check off what applies. If you don't see the need here, then either don't check off anything or check off what's the closest to what they need. This section here is used for the 90-day follow-up. We're not doing those right now, but it's good to continue to stay into the practice of doing it, so complete it the best you can. This date here automatically updates. So if you create the DCF today, it's going to put that date in here. But if you go back into an existing, somebody that you already talked to but forgot to do the DCF, you'll want to make sure you update it to that date that you talked to them. You're going to fill in their current living situation. So if they are calling and they live at home alone, you're going to mark that off. If they're homeless, you're going to mark that off. Same thing with payer source. You're going to mark off which payer source they have. So if they're Medicaid or Medicare, if they have both, if they have VA benefits, private pay, I'm pretty sure we will never have a state funded only person. That is just an option for nationally for people. So, but we don't have that option here. You can check off uninsured and unknown. Mary already talked about this. You can skip that. You do not have to check that. That was brought to, that was put in this originally to remind people that they needed to do a STARS form if it was a ship encounter. I think I just saw someone raise their hand.
Yes, and we also have a question in the chat as well. So we'll start with the person who raised the hand. Oh, same person. Lee, go ahead.
Yeah, so I'll just, I posted in there. So we get a lot of calls for basic financial aid. I've had everything from, a guy that's an amputee and he needs a new prosthetic leg. Leaking roofs, new furnaces, and some of it, and I go through and sometimes I find out they need food and they need transportation, but sometimes it's just a financial assist, but there's no financial assist box there. And we do a lot of connecting people to places like Women Aid and the Share Fund, and I just would love to see a box that said financial assist.
Lee,
'Cause
the problem is, and I've argued this out because I don't necessarily agree with the terminology on these forms sometimes.
Okay.
And my understanding is these are captions that best fit the federal definitions of what they're trying to pull for data. And that's why they're used this way. And that's so what happened is that we really had to sort of develop our own understanding of what they mean in order for us. So like with access to healthcare, that's going to include Medicare, that I meant Medicaid. That's going to include, somebody applying for, nursing home, for assisted living, anything that is related to healthcare systems. So we've had to sort of extrapolate out what we do in terms of some of the information we give out, how it meets into those categories.
So if I were helping a man and putting a considerable amount of time and finding resources to help him get a new prosthetic leg, would that
That
go
would be
under
access
health?
to, that could go under health, absolutely.
Okay, all right.
Yeah, so that's what we
housing.
Yep. So a lot of times what we have to do is sort of take what we're doing and find the category that it most likely relates to. That's the best way of working
shove it
it.
in the box, even though it doesn't quite fit.
Thank you.
You're welcome. Any other questions before we move on?
Elise, you're a little staticky.
It's Nancy. I have another question. I'm sorry.
Oh, go ahead.
If somebody calls and let's say, for example, they just want transportation resources to get them to a doctor's appointment, we're not really asking them for pay or source, like Medicare, Medicaid, or that sort of thing, or maybe, are we? I mean, like, I guess I want to know how much do we have to fill out this form?
Well, if somebody calls for transportation, I mean, one of the questions you want to know is, can they privately pay for transportation, or are they looking for, like the National Transit or one of the transit authorities that might be a little bit easier, or are they on Medicaid and do they have an MCO? And so there is a little bit of information when someone calls up just for transportation that you could in fact make it a DCF form. It all depends upon when the person's calling us, how much information we need to sort of get from them in order to help them with the best options for them.
Okay, so we really need to do some kind of more digging to get, and we should be able to answer all those questions.
Yeah. So I mean, if somebody's calling up and says they need transportation, I mean, one of the first questions is, what type of transportation do you need? Are they talking about, just going to the shopping, or are they saying, well, no, I got to go to a medical appointment? Well, is the medical appointment, we have calls in Nashua, they're going up to Dartmouth Hitchcock, or up in Lebanon. So that's a whole different ball game in terms of, what type of transportations might be available to them. So it really does depend upon the questions coming in. We do, in all honesty, probably very few true INR calls versus a lot of options counseling calls.
Okay.
Just on the nature of how we do our work.
All right. So we should be asking like questions about their living situation and all of that when they call, so we can answer all these questions?
Well, not necessarily their living situation, but you want to understand what type of like transportation they need. Do they, right.
There's a box there that says living setting.
Well,
if it comes up naturally in the conversation, then you can fill it in. If it doesn't, then maybe some other day down the line when you do talk to them, it does, and then you can fill it in.
Right.
Oh, okay, that's all I needed to know. So there is some sort of, you can just proceed through this process without necessarily completing every single item.
Correct.
Okay.
Right.
Thank you. Thank you.
All right, and it looks like Tammy has a question. Go ahead, Tammy.
Yeah, I'm just kind of piggybacking off what Nancy was asking. Is there anything that absolutely has to be captured in this form? I'm hearing we can skip around and gather things, but is there stuff that absolutely is needed in order for the data to be pulled?
From my understanding, Tammy,
No.
they're just pulling the basically they're counting the data collection form when they pull it, but I don't know for sure exactly what information in it that they're using in the no wrong door tool. Does that make sense?
Yeah, I guess I was just wondering if we had identified any must fill out sections of the form. If we're skipping around, if doing the best we can, are there any must haves when we're filling out this form?
I think, Tammy, to be honest with you, I think they're counting the DCF form as having us done, that we have done a PCOC interaction. That's the basic. I think that what part of the old refer form in the options counseling form then is the action plan and the action plan actually is I think the basics of what a PCOC is supposed to be. So if for nothing else, I would make sure we're at least clicking off for the action plan. And the action plan is anything in terms of if we've provided them a way of reaching out to the resources, if we've provided them with a way of applying for state programs, all of those are considered action plans. We're providing an action for them to complete or for us to complete. So I think if anything, though, that would be the one thing for me that I would want to make sure gets checked.
Okay, that's helpful. Thank you.
Other question?
I think you're all set to keep moving forward, Elise.
So Mary was just talking about the action plan piece. This is where you would mark that. So if you help them develop a plan, you're going to check off yes. And then over here is where you put in whether it was written / emailed, verbal, video, or other. Once that's completed, then you want to hit save. If you get out of this form without hitting save, you'll have to start fresh. So we're going to want to save that. We're going to scroll back up, and now you can see that we have today's saved and the previous one saved. I want to go back into that one. So these are the sub forms. So you can ignore the New Hampshire Family Caregiver sub form. They are working on deleting that because we now collect this data in T-Care. We don't need it anymore. The hospital transition sub form. This is completed only if you have a formal agreement with a hospital. It looks like Kelly has a question.
Go ahead, Kelly.
Yeah, I just, you said they're deleting the New Hampshire Family Caregiver form.
The sub form, yep.
But T-Care doesn't cover grandparent caregivers. So what happens with them?
Are you still on?
But who are you asking for?
Tina Goulet.
Yes, I am here. I thought that's what you were asking. I just wanted to make sure. Sorry. Yeah, so my understanding is that we are supposed to, but then I wasn't sure if maybe things changed. So I thought maybe Mary and Elise knew more than I did. So
It's going back and forth with
yeah, that's my understanding too. It's funny like that. So we yeah, we don't I guess we should do it for grandparents for now. Does that make sense?
Yeah. Yeah, I was just curious because I know that all the questions in TCARE are regarding dementia and things like
Right.
that, so.
And it's only, yeah, you can only use it for those caring for an older adult.
Yeah.
And it's not for grandparents. So as of right now, so initially I had told people not to use this ever. And then Tom had corrected me. And then he told me to use it for everyone. And then, so that's why I know I've confused people a lot. That's why I was thinking I'll just defer to Elise and Mary.
Yeah,
You guys
if we have no way of
Oh, Tom,
pulling,
you're here. I'm
yeah,
sorry.
if
Okay,
no
Tom.
problem.
I'll defer to Tom. How about that?
If we have no way to capture the encounter, to be able to report out the encounter, then it should be collected that way. Yeah.
Okay.
Okay, Tom, but there's a difference between doing the subform and doing the DCF form. Is the subforms able to be pulled? That's the
Mary.
part that has to get clarified.
Okay. So I actually have a meeting coming up with Erica
Okay.
to dig into that. So I will
Okay.
make sure I put that question down.
Because they can do a DCF form on a grandparent just for the simple fact that they've done options counseling with the person.
Yeah, exactly.
But it's but then it becomes, do they do a sub form, which is a whole different piece of information that's pulled. So that's the part that just needs to be clarified.
Yeah,
I'm not
I
saying
think,
don't do it. I'm just saying that, yeah, if it's only grandparents, but I don't know whether that's pullable for the state in terms of information gathering.
yeah, and I think it is. It's just a lot more complicated to pull the data. But again, I'll confirm that. But also, Tina, I think it would be important. You know, if you don't think, because like you said, Mary, we capture the encounter through the DCF form anyways. So if the subform is not going to capture information that you need, Tina, then the answer may be that we don't need to do the subform in those situations.
Yeah, what I would like is to maybe work with Missy, because Missy, or maybe Elise and Mary, because Missy was showing me how there's a lot more data captured in Navigate when done well. Or she's able to do the she's able to pull data that I didn't realize we could do. And I'm not sure where that data is coming from exactly. So if I can maybe work with Missy and maybe Erica to see where that data is coming from, I think that would be really helpful for me to see, like Mary's saying, if none of that data is coming from that caregiver subform, then like Mary's saying, maybe that's not the piece that that we need so much.
Yeah,
but
I agree with that.
I mean, right now, what probably we should suggest is that if it is a grandparent, it doesn't hurt to do the form. It's just one more box, a couple of boxes that you have to click off. That way, if the data can be pulled from there, you have it. And then once we figure out where that data is coming from, then potentially the decision can be made as to whether or not we continue with that particular subform or not. Make sense?
Yes.
Yeah, I think so.
Okay.
Okay, so just to be clear, we're doing a DCF form for all caregivers.
Correct.
And then a sub form for grandparents.
Correct.
Okay.
All right, and it looks like we have another question. Go ahead, Betsy.
So application assistance, you press if you're going to help them fill out any application for assistance. It could be as part of the plan that you've created with the person. The hospital assistance, I need an example of that.
So hospital assistance is only if you have a formal agreement with a hospital.
And why and when?
And Tina, what counties have the formal agreement? Maybe that's easiest.
Cheshire County.
Okay. So only if you work for Cheshire County would you do a hospital transition form.
Okay, thank you.
Okay.
And thanks for pulling up what happens when you click on application assistance. Financial assessment for a public program. Okay.
Okay, the wording on these questions is strictly based upon the federal statements that are made in the guide. So we have had to interpret what those mean. Okay, so we don't technically do a financial assessment, but if we start talking to them in terms of the eligibility criteria for any of the programs, that's financial assessment. If we're talking to them about what it means to meet, that they need to meet the medical criteria under the programs, that's the medical assessment piece.
Okay.
So the language has to, the language has to stay as it is.
Yeah, no, okay, this is good. Okay, that's understandable. Then you hit the save button after you fill out the midsection. And then you're going to continue on to this last section. And if you open up the tab application assistance, or, then I'm going to hit the save button.
Yep. Yeah. So if you go through it, if you help someone with and explain the financial criteria for the program, you hit yes. If you explain the medical criteria, yes.
Yeah.
Did you apply for more than one public program? So did you help them apply for food stamps and Medicaid? Yes.
Safe link, I see that. That's good to know. Programs assisted with, that's a good detailed listing of programs. That's good, okay. So you hit save.
Yeah. So once you click off everything that you want to click off, then you hit save.
Thank you.
Save, and then you'll see the sub form here. You can close, save again. It says it already exists, but I always like to save just to make sure. And then close, and we can see that everything is still there. Close. And now when we're back at the data forms tab, we can see that the old one is there and the new one is there. If I wanted to reopen the data form from today, I just click on that blue text, brings us here, and then I click on the blue text again, and it brings us to this data form. So say we were talking to them again, and we found out that they that they live with someone else, and that they have Medicare only. We can update that and then hit update data form, and it will update.
So I just realized I hadn't read that before today's training. So it's really at the 90-day follow-up is only when you use that bottom part. And one thing is that I must not have been complete. I've been attempting to use the data collection form, and I don't think you're supposed to get notified by the system at the 90 days, right? No.
So they turned that off because we're no longer collecting that data right now.
Yep.
But you're still wanting to enter it just in case for some reason they start asking us to do it again.
All right, so I really need to be putting this on my calendar. My own.
No, we're not doing 90-day callbacks. If you're following up, that's a follow-up in Navigate. But the 90-day callback was a whole different program.
So
and a different reason for collecting the data. So that doesn't exist right now for us.
I'm not going to fill out the encounter sub forms other than, for my purposes, probably the application assistance. Then I'm going to say, very good. And then in Navi, I'm going to put a note. If I feel it's important to follow up with a person, I can put it in Navi.
Correct. All our follow-up should go in Navigate. The 90-day callback was a whole different concept of what was needed to do. So we were calling them back for specific reasons that had nothing to do with us following up with someone. So those are two totally separate concepts. Okay.
Excellent. That explains it. Okay.
Yeah. So if you need to follow up with someone, that goes a follow-up into the Navigate.
Thank you.
Okay.
Is there any other questions? Anything else you want us to show you?
It's very very helpful. Thank you very much.
You're welcome. I'm gonna stop sharing now.
All right, so I have recorded this meeting. So what I'm going to do is I'm going to have it converted into a YouTube video so we can have it for future reference for new staff or for individuals who kind of want a refresher. I also think it would be helpful if we sent a copy of the slides to staff so they can kind of go back and refer to everything that we went over today.
Yes, I'd like one. I know that for sure. Yeah.
Yeah. So thank you so much for joining us today, and we're all set. And I hope you guys all have a great day. And a huge thank you to Elise and Mary for all of the information you provided us.
Bye, guys.
Thank you, everyone.
All right. Have a good day.
Thank you. All right. Bye-bye.